Hey, good morning, everybody. So nice to see you. It's very exciting to see so many people here. Um, and I want to thank Jennifer Wood. Jennifer Wood from Green Bank, West Virginia, was the one who had the original intention for today's gathering, and she's an architect who lives in the radio-free zone because of her sensitivities to wireless radiation. I want to first start by acknowledging those who came before us and on whose shoulders we stand. The early activists in this field going back at least 20 years. People like Janet Newton of the EMR Policy Institute, Diana Warren on her board, Cindy Sage of Bioinitiative Report, Shellis Glendenning of New Mexico, Arthur Furstenberg, Virginia, whose book is here, Virginia Hines of Massachusetts, Livy Kelly, my co-author Magda Havas of Canada, and science writer B. Blake Levitt. Today we are part of a continuum of energy, and that energy is growing, thank goodness. Forces for good are building, and we need to come together to drive this issue home, and not just among the EMF activist groups, but among our our comrades in other fields of health and environmental activism. Together as a tribe, I believe we represent at least 75% of the population. We are the majority. We must embody the confidence that our efforts together will bear fruit and find our place and build our collaborations and networks. Like Neil Young said, we need to stand up, and it starts with you and me. So I believe we must grow our ranks by speaking from the heart about how the proliferation of wireless is impacting us, about our suffering, our health challenges, isolation, and in many cases desperation, so that the impulse to care in other people is activated. And of course, we need to raise awareness about the coming 4G LTE and 5G antennas that bring the health and environmental impacts to an entirely new level. In a letter to to Governor Jerry Brown of California the other day, Dr. Martin Paul wrote of 5G antenna radiation. We can expect humans to suffer from massive increases in blindness from cataracts, macular degeneration, and retinal detachment, large increases in hearing loss, very large increases in male infertility, melanoma skin cancer, peripheral nervous system impacts with neuropathic pain, impacts on immune cells, impacts on red blood cells, leading to very low oxygen in the tissues and impaired transport of nutrients into the tissues. And he said the impacts on insects, including bees and other pollinators, birds, small mammals, almost all plants, will be even much more severe than the impact on humans. So the impact, the EMF issue is not just any old cause, and that is why I'm here, and I'm sure why you're here. It is about democracy. It is about taking back state and local governments' rights. It's about informed consent to this exposure to radiation. It's about affirming our individual right to health and the chance to have a decent life on this planet. And it's about sovereignty over our own bodies. And it's about getting corporate money out of politics and building an independent media that is not financially dependent on toxic polluters. The movement is about saying no to EMF pollution and to the many forms of corruption that is driving it in media, in government, universities, associations, and the false front nonprofits that have official sounding names in the name of good, but actually are fronts for industry. There are many aspects of deception and deflection and actions not aligned with the greater good built into this issue. The overarching concern, of course, is that we are on a trajectory that presents an extinction risk for humans as well as the ecosystem. Further wireless technologies like the 5G antennas planned will most certainly accelerate our demise. Let's take a look at the big picture here. We've got tremendous growth in cell phones and wireless devices, wireless networks, smart meters on people's homes. We've got the multi-billion-dollar wearable wireless industry. It continues to grow rapidly. We've got Wi-Fi from space, from satellites and balloons and drones, and even wireless power transmission in development. So I ask, is this the kind of world that we want? Blanketed in radiation to grow the profits of unethical companies and support the sickness industry.
I know, 3 cheers for unethical human rights violation, crime against humanity.
The science on this subject is very compelling. All you really need to do is read the 2 letters sent to Governor Brown from Dr. Beatrice Gollum of UC San Diego and Dr. Martin Paul. And in particular, the 142 review studies attached to Martin Paul's letter that together cover thousands of studies showing biological and health effects that the industry says do not happen. So it's no longer an issue of is there enough science? We've known about the risks for decades. 46 years ago, in 1971, the Naval Medical Research Institute published a report, Bibliography of Reported Biological Phenomenon and Clinical Manifestations by Zori Glaser. It included over 90 non-thermal effects from electromagnetic exposure, including dozens of neurological effects and effects on chromosomes and much more. 36 years ago, in 1981, NASA published a report called Electromagnetic Field Interactions, Observed Effects and Theories. What we know as electrosensitivity today was described in that report: headaches, eye strain, fatigue, disturbed sleep, memory impairment, attention difficulties, and so on. That was 36 years ago. 15 years ago, in a letter to the EPA, and any journalist who might be here would like to get these documents, we have them. 15 years ago, in a letter from the EPA to Janet Newton of the EMR Policy Institute, you can just hold it up. They said, this letter said, the FCC's current exposure guidelines, as well as those of the IEEE and ICNIRP, are thermally based and do not apply to chronic non-thermal exposure situations. They are believed to protect against injury caused by acute exposures that may result in tissue heating or electric shock or burn. So let me repeat. They said the FCC current exposure guidelines are thermally based and do not apply to chronic non-thermal exposure situations. 6 years ago, in U.S. government research at the NIH, Dr. Nora Volkow and her colleagues at the Department of Energy Brookhaven National Lab published a study showing brain glucose metabolism effects from cell phone exposure. So in 2014, in a letter from the Department of Interior to the National Telecommunications and Information Administration of the Department of Commerce, they said FCC standards for cell phone radiation are outmoded and no longer applicable as they do not adequately protect wildlife. They reported nest and site abandonment, plumage deterioration, locomotion problems, reduced survivorship, and death. And they said, however, the electromagnetic radiation standards used by the Federal Communications Commission continue to be based on thermal heating, a criterion now nearly 30 years out of date and inapplicable today. And then more recently, and Ellie Marks is going to talk about this study, there was the National Toxicology Program study, part of the NIH, that showed that confirmed prior research showing brain cancer from cell phone exposure, heart schwannomas, as well as DNA damage in the brain from both GSM and CDMA modulation. These, of course, are examples. There are thousands of studies from all around the world, but who is listening? There was even a study supported by the commissioned by the industry itself, called the Ecologue Report in the year 2000. And if anyone would like to see this, it contains all the things we know that are happening biologically, including the cancer risks and risks to children. This was the year 2000. So who's listening? Who's listening? Nobody's listening. My passion to support communications in this field is due to the corruption. We've got the U.S. government, including the FCC, but also members of Congress are ignoring research from around the world that allows this destructive industry to thrive. The Harvard University SAFRA Center for a report called Captured Agency, how the Federal Communications Commission is dominated by the industry it presumably regulates, described how this industry is operating with the same playbook as tobacco, including refusal to examine the health evidence, undermining the credibility of the scientists, publishing contradictory science, and so much more. But the good news in that report was that their own consumer research done in conjunction with that report showed that were citizens to understand the actual health risks from cell phones and wireless devices, technology use behaviors would change, and these would have significant economic consequences for the telecommunications industry. I hope that happens. In another example of our government not cooperating is in just a little over a year ago, Jim Turner's law firm sent a letter on behalf of National Institute for Science, Law and Public Policy and Environmental Health Trust to the FCC, questioning how they could justify that their current thermal exposure guidelines, even the thermal exposure guidelines, are being enforced when the methodology that they're based on, the IEEE methodology, actually allows a 30% margin of error. And so by our estimation, the majority of cell phones on the market today would be probably over the FCC 1.6 watts per kilogram limit. We also asked 11 other questions, including how they could possibly construe that children are protected by their current safety guidelines. It's been just over a year and we have heard nothing back. So I'm urging you today to contact the FCC as well as members of Congress and demand a response to this letter. And then we also have 33 recommendations. There are several people. Ellie has some of them. 33 recommendations to the FCC. We'd encourage you to share those as well. So, of course, I'm getting short on time here, but we want to touch on the corruption in the media. We've seen, Ellie's going to talk a little bit about what we've seen in California, but when the NTP study came out, we got a lot of good coverage telling the truth, saying this was a game changer, but also there were articles that intertwined in the text were things that were creating doubt, that were misleading, that were peppered. Some of these articles were just peppered. And Joel Moskowitz of UC Berkeley had to do a chart explaining spin versus fact. What's the truth? Because we're just constantly being manipulated and lied to. The 13-country Interphone study that showed a risk for brain tumors, when that came out, headlines all around the world said no risk found, when actually the Interphone study showed double to quadruple risk for brain tumor in the heaviest cell phone users, which was only 1,640 hours at that time. The Economist was one of the worst examples of media corruption on this subject that I have ever seen. And we did a critique of this, and they just, one lie after the other. I mean, they said, let it be said once and for all that no matter how powerful a radio transmitter, whether an over-the-horizon radar station or a microwave radio wave, simply cannot produce ionizing radiation. Well, that's true. Then they say the only possible effect they can have on human tissue is to raise its temperature slightly. Is that true? No. No. Okay. They also said, in the real world, sources of ionizing radiation are the sole sources of energetic enough to knock electrons out of atoms, breaking chemical bonds and producing dangerous free radicals in the process that can damage a person's DNA and cause mutation, radio wave sickness, and even death. Is that true? That's the only thing that can cause mutations? No. No. In fact, the NTP study just proved that the DNA effects, and there are plenty of studies showing DNA effects. So I don't want to take any more time, although I could. I could show you all the deception in the science where, headlines don't match the body of the science, and there are no conflict of interest statements on studies that clearly are denying the risk. So I just want to end on talking about children briefly. We know that the children exposed in utero from mothers, pregnant women using cell phones, have a UCLA study showed social and emotional problems later in life at about age 7 when they enter school, about 54% higher increase in social and emotional problems. A Yale study in animals also showed ADD-like behaviors from the mothers in utero exposure. A NATO study showed organ damage from fetal exposure, damage to the brain, liver, skin, and eyes. And of course, we know that tech use is causing addiction in children as well as depression and anxiety. Now, certainly there are other factors that are contributing to the addiction, like the dopamine bursts from overstimulation, effects from the screens, the programming that is increasingly designed to addict children, but also, and many people don't know this, the addiction is being partly caused by the increase in endorphins from the microwave radiation. So it's a travesty what's happening to children. Also the fact that we have children with diabetes is growing in children, when in Saudi Arabia there was a study that showed 2 different schools, cell tower equal distance from each school, one tower more powerful than the other, and in the higher powered tower there was a greatly increased incidence of hemoglobin A1C level and diabetes in these children. So I think it's really a travesty what we're seeing happening in these serious conditions emerging in children, but also the attention, memory, perception, all of these factors that are impacting their learning and their formation as people. So we need to stand up, and soon we're going to be publishing a study or a report describing what we need to be investing in instead of all of these wireless antennas distributed across this country. There is a way to do it safely, to have advanced telecommunications. We're not doing it. We're not doing it because the wireless industry is interested in their short-term profits, and it can be done. So we hope that when that paper is ready that you'll share it with your people. And I guess I want to say that, I'm so pleased to be here with you. We're all they were all representatives of the human race and representatives of the planet, and we have to win this one. So thank you everybody for organizing.